Hello people, in this video we are trying to understand this terminology post-term pregnancy or you can say post-maturity. So what is this post-term when you're saying? So this lady has an estimated delivery date, so which is this date, okay, this date in the calendar you have given, but beyond that she's coming for delivery. Okay, that can be in layman's terms, you can say like that, but clinically the definition is 2 weeks after this date, then only you can say it is post-term. Now, what are the problems? Why you should tell a woman to please come before your estimated delivery date, estimated due date? Why should you tell that to the person? Interestingly, you will meet a lot of women who don't come, and then they say that no, we just were waiting for normal labor to happen, and they don't realize the complications that would have been there for the baby. Inside the baby, what will happen? It will not be so happy because it will have oligohydramnios, less amniotic fluid. It will have cord compression. It can have mainly placenta. The placenta would have aged, okay, not able to supply enough nutrients for this baby. So what it will do, under the stress, this baby will pass meconium, that is the stools, the first stools of the baby, it will pass, and this same meconium, it is going to enter the lungs of this baby. And what will happen to the lungs of the baby? There can be chemical pneumonitis. Okay, so that is what you have to understand here. What are the complications of post-term pregnancy? Guys, please pay attention here. Post-term pregnancy, there can be placental aging, there can be infarction of the placenta, there can be infarction of the placenta, there can be calcification of the placenta. Okay, so basically the baby is suffering here. There can be fetal hypoxia, there can be acidosis, there can be, there can be a big baby, right? There can be macrosomia, they're talking about the head here. There can be oligohydramnios, the fluid around it can decrease, which can lead to cord compression. The umbilical cord, what can happen to the umbilical cord? Because of the diminished quantity of Wharton's jelly. Okay, so there can be compression of the umbilical cord. Guys, are you paying attention here? The cord is getting compressed because of the diminished quality of the Wharton's jelly, right? So then meconium aspiration, so this baby will aspirate its own, that is going to take into its lungs its own stools. So when this baby is born, you see, first of all, when this mother comes, when you run an NST, you will see that there can be some fetal distress in the NST. So if this is the contraction, there can be some decelerations in the NST, right, which is very bad, right, indicating fetal distress. And when this when you take this mother for a lower segment cesarean section and you deliver the baby may not cry, and when it doesn't cry, you have to aspirate, and when you aspirate, what comes out is could be the meconium, right? It can be the meconium. So when the meconium is trying to when you're trying to suction this meconium, it will be so thick, it is very difficult to suction it, so the baby goes into more distress, remember. Okay, so there can be let us say shoulder dystocia. It is very difficult to get this baby's shoulders out, right? And there can be non-molding of the head because there's hardening of the skull bones. This baby is so mature, isn't it? So it is going to have hardening of the skull bones. It's so difficult to get it out when there is no molding. So looks like here the problem is mostly for the child. Okay, guys, are you paying attention here, or is it becoming too much for you to understand? So for the baby's lungs especially, what they are saying is there can be meconium aspiration, there can be atelectasis. What is atelectasis? That is lung collapse can happen, right? So that's what they have written here, right? For this baby, there can be pulmonary hypertension. All these are the result of meconium aspiration. So what is meconium aspiration leading to? Come on, say it. Chemical pneumonitis, atelectasis, pulmonary hypertension. Okay, so this baby will have so they have written here respiratory failure. So this baby will have to go into NICU admission, where they'll have to give it they'll have to suction out all this, and they'll have to give oxygen, etc., etc. It will come out with a low APGAR score, not crying at birth, etc. Remember, there can be stillbirth. That means in even worse scenarios, this baby would be born dead. So remember, so you should always be careful about any counseling any woman to to clearly tell her that she should come for follow-up so and so dates, right? So did you get the idea, guys, about the complications of post-term pregnancy? So that's it for now in this video, guys. We'll meet you in the next video. Bye bye.